Let's talk about maxillary impacted wisdom teeth extraction. One of the keys with impacted wisdom teeth is to extract the tooth, if you're going to extract them, at the right time. In a perfect world, this is what I was taught in my surgery fellowship, Baylor Dental College. You'd like to extract the wisdom teeth when about 1/4 to 1/2 of the root is formed. It's an easier extraction. You've still got the follicular sac around the wisdom tooth. You don't really want to extract them when there are no roots because the wisdom tooth will roll, but you'd like to have 1/4 to 1/2 of the root formed when you extract the wisdom tooth, ideally. So these are maxillary wisdom teeth, and if you can catch them at the right time, generally they're easier than impacted mandibular wisdom teeth. So you can see this is the left, so this is about 1/4 to 1/2 formed. I like to have a periapical radiograph and see how high the wisdom tooth is and how close it is to the roots of the second molar. So you can see this is going to be your purchase point right here. So you can do skull drill, which is what my football coach in high school used to call it, before the game, and talk about the strategy you're going to use in the game. So I know I'm going to place a periodontal elevator in this thin area and torque it just a little bit and work my way up to other wider elevators, but you're going to start with a periodontal elevator and move the tooth backward. One of the most important things to do is place a 2x2 in the mouth, because you think, what's the worst thing that could happen? You don't want a patient to aspirate a tooth. They'll be sure you always protect the airway. So you use your barred Parker and make a vertical incision to the distal buccal of the second molar, and then you cut around the second molar and then straight behind the second molar. So there's 3 incisions, this vertical one and then a mesial one and then one distal to the second molar, and you want all those to converge, and then you're going to reflect this flap. Then again, I'm going to use this periodontal elevator, place it in that small space between the wisdom tooth and the second molar. I call these kissing teeth because they're so close together, many times you can't get a normal elevator in that space. So use that periodontal elevator and just get it moving. Then you can place the 301 elevator in there, and then the bar elevator, and move it out. Now once this starts moving, I'm going to be sure to put a 2x2 in the mouth. See, now here's the 301 Hugh Freedy. I've opened a space with the periodontal elevator. Now I'm going with the 301. Now I've got the 2x2 in the mouth to protect the airway. And then I use this crossbar, Potts crossbar elevator, to move that tooth up and back. So I've got the 2x2 in here protecting the airway. Here it comes. It's got the follicular sac around it, which makes it easier to extract if you've got 1/4, 25 to 50% of root formation. Now I'm removing the follicular sac with the rongeers. And this is 3-0 plain gut suture. They'll dissolve in 3 to 7 days. Normally for maxillary wisdom teeth, I just place 1 suture. And the way I suture, I wrap 1, 2, or 1, 2, 3, pull. Those are away from me. Then I wrap 1 toward me and pull, and then wrap another one away from me and pull. Now if the tooth is high and I've had to make a pretty high vertical incision, then I may place 2 suture, but normally I just place 1 for maxillary impacted wisdom teeth. The ideal age to remove these is normally when the patient's about 17 or 18 years old. be sure you give an intraligamental injection if you're extracting a tooth, doing endodontics, anything that could be, that could be painful. And that completely anesthetizes the tooth. You can see this one's pretty high. And again, the roots are about half formed. That's about right, but you can see there's not much space in here. So in your skull drill, you've got to say, what can I slide into this space? And I try to visualize it before I start. I know I'm going to have to go probably a little past the CEJ of the second molar and try to slide that periodontal elevator in about right here and just torque it just to move that tooth away from the distal of the second molar, then place my 301 and then my Potts crossbar elevator. Get it going. Now again, the vertical incision with the 15 Bard Parker, facial of the second molar and distal of the second molar. Then here's my periodontal elevator, select that tissue. So sometimes there'll be bone on the facial of the wisdom tooth. In that case, you've got to remove it either with your rongeers. Sometimes you can remove it with a periodontal elevator because the bone in the posterior maxilla is the softest bone in the mouth. Remember, the hardest bone in the mouth is the mandibular anterior. Second hardest is the mandibular posterior. Third hardest is the maxillary anterior. And the softest bone in the mouth is the maxillary posterior. So sometimes you can remove that facial bone with your periodontal elevator, or you can use your rongeers, which I'm doing here. Occasionally you'll have to use a round burr and create a purchase point. See, I've got my 2x2. That's so important. You don't want the patient to aspirate the tooth. You don't want it to go flying into the mouth because they're probably sedated. So I'm trying to create a purchase point between the mesial of the wisdom tooth and the roots of the second molar. And you've got to use a small, thin instrument like a periodontal elevator, or then you'll progress to your 301 Hugh Freedy elevator. Just roll it. Then here's the Potts crossbar elevator. And once you get to this elevator, it'll come pretty quickly and you're going to move the tooth up and out with the 2x2 in the mouth to protect the airway. The higher it is, the harder it is to extract because you've got that volume of bone behind it. So you've got to lift the tooth up and out. You don't want to go straight back because there's just too much bone behind it. Go back and remove the follicular sac. Then again, this is 3-0 gut suture. Take as deep a bite as you can and it won't pull loose. So 1, 2, or 1, 2, 3 away from you, then 1 towards you, then 1 away from you. And like I said, normally I just place 1 suture for a maxillary impacted wisdom tooth removal. Since those teeth were higher, I had to make a longer vertical cut, so I'm placing 2 suture per wisdom tooth. That's the dental minute. These techniques work and they work every time.
It's time. It is time to take your dentistry practice to the next level, and you know it. You just haven't known how to do it until right now. That's where dentistrymasterclasses.com steps in. At dentistrymasterclasses.com, Dr. Cutbirth is offering you his greatest work and his best cases. Here's everything that you're going to get when you subscribe to dentistrymasterclasses.com. Incredible comprehensive cases not seen in Dental Minute videos, an organized library of all the Dental Minute videos, and Dentistry Masterclasses comprehensive cases for study and reference. And you're going to get before and after photos of Dr. Cutbirth's fantastic restored work. So, great deal. $40, that is it. For $40, you're going to get all of this. So go right now to dentistrymasterclasses.com and subscribe today and change your life, change your practice.